Welcome back to our channel. Today, we're diving into a crucial topic for those of us over 50. Iron deficiency. It's more common than you might think, and understanding the signs and how to fix it can make a big difference in your health and well-being. So, let's get started. What is iron deficiency? Iron deficiency occurs when your body doesn't have enough iron to produce adequate levels of hemoglobin, the substance in red blood cells that carries oxygen from your lungs to the rest of your body. Without enough iron, your body can't get the oxygen it needs. Why is iron important, especially after age 50? As we age, our nutritional needs change. Iron plays a critical role in maintaining energy levels, supporting immune function, and keeping your brain and muscles healthy. For those over 50, it becomes even more important because our bodies may not absorb nutrients as efficiently as they used to. Common causes of iron deficiency in people over 50. Several factors can contribute to iron deficiency in people over 50. These include dietary habits. A diet low in iron-rich foods can lead to deficiency. Many people over 50 may not consume enough red meat, beans, lentils, or leafy green vegetables, which are excellent sources of iron. Medications. Certain medications can interfere with iron absorption. For example, antacids and proton pump inhibitors used to treat acid reflux can reduce the stomach's ability to absorb iron. Medical conditions. Conditions like gastrointestinal bleeding, ulcers, or chronic diseases such as kidney disease or inflammatory bowel disease can cause iron loss or reduce absorption. Menopause. For women, menstrual blood loss is no longer a factor after menopause, but other changes in the body can still affect iron levels. Reduced estrogen levels can impact iron metabolism and absorption. Signs and symptoms of iron deficiency. Recognizing the signs of iron deficiency is crucial. Here are some common symptoms to watch out for. Fatigue. Feeling unusually tired and lacking energy can be a sign of low iron levels. This is because iron is essential for producing hemoglobin, which helps carry oxygen to your muscles and tissues. Pale skin. Hemoglobin gives blood its red color, so low levels can make your skin appear paler than usual. Shortness of breath. If your hemoglobin levels are low, your oxygen levels will also be low, leading to shortness of breath during everyday activities. Dizziness and headaches. Low oxygen levels can cause dizziness and headaches. This is because your brain might not be getting enough oxygen to function properly. Cold hands and feet. Iron deficiency can lead to poor blood circulation, causing cold hands and feet, brittle nails, and hair loss. Iron is vital for maintaining healthy cells, skin, hair, and nails. Deficiency can cause hair loss and make your nails brittle. Heart palpitations. Your heart has to work harder to pump oxygen-rich blood around your body, which can cause irregular heartbeats or palpitations. How to fix iron deficiency. If you suspect you have iron deficiency, it's essential to consult with a healthcare provider for proper diagnosis and treatment. Here are some general steps to help manage and improve iron levels. Increase iron-rich foods. Incorporate more iron-rich foods into your diet. Good sources include red meat, poultry, fish, lentils, beans, tofu, spinach, and fortified cereals. Pair iron with vitamin C. Vitamin C enhances iron absorption, so try to include foods high in vitamin C, such as oranges, strawberries, bell peppers, and broccoli, with your iron-rich meals. Avoid iron blockers. Certain foods and beverages can inhibit iron absorption. Try to avoid consuming coffee, tea, dairy products, and high-fiber foods at the same time as your iron-rich meals. Consider iron supplements. If dietary changes aren't enough, your doctor may recommend iron supplements. It's important to follow your doctor's advice regarding dosage, as too much iron can also be harmful. Monitor and treat underlying conditions. If an underlying medical condition is causing iron deficiency, such as gastrointestinal bleeding or chronic kidney disease, addressing that condition is crucial for improving your iron levels. Additional lifestyle tips to enhance iron absorption. Beyond dietary changes and supplements, there are other lifestyle adjustments you can make to improve iron absorption and overall health. Cooking with cast iron. Using cast iron cookware can increase the amount of iron in your food. This is particularly effective when cooking acidic foods like tomatoes. Reducing stress. Chronic stress can affect your digestive system and nutrient absorption. Incorporate stress-reducing practices like meditation, yoga, or regular exercise into your routine. Staying hydrated. Proper hydration is essential for overall health and can help improve nutrient absorption, including iron. Aim to drink at least 8 glasses of water a day. Regular checkups. Regular visits to your healthcare provider can help monitor your iron levels and overall health. Early detection of deficiencies can prevent more serious health issues. Iron-rich recipes for a balanced diet. To help you incorporate more iron into your diet, here are a few simple and delicious recipes. Spinach and lentil soup. This hearty soup combines iron-rich spinach and lentils with tomatoes, onions, and spices for a nutritious meal. Beef and broccoli stir-fry. A quick stir-fry with lean beef, broccoli, bell peppers, and a soy sauce-based marinade. Serve with brown rice for added fiber. Chickpea and spinach salad. A refreshing salad with chickpeas, fresh spinach, red onions, cherry tomatoes, and a lemon tahini dressing. Add some grilled chicken for extra protein. Iron-fortified smoothie. Blend together spinach, kale, banana, strawberries, and a splash of orange juice for a vitamin C boost to enhance iron absorption. Iron-rich snacks and meal planning tips. In addition to main meals, consider iron-rich snacks to keep your energy levels up throughout the day. Nuts and seeds. Almonds, cashews, and pumpkin seeds are great sources of iron and make for convenient snacks. Dried fruits. Dried apricots, raisins, and prunes are not only high in iron but also provide a quick energy boost. Dark chocolate. A moderate amount of dark chocolate can be a delicious way to increase your iron intake. Look for chocolate with at least 70% cocoa content. Meal planning. Planning your meals ahead of time can help ensure you include a variety of iron-rich foods in your diet. Consider preparing meals in batches and freezing portions for easy access. Conclusion: iron deficiency is a common issue for people over 50, but it can be effectively managed with the right approach. By recognizing the signs and symptoms, incorporating iron-rich foods into your diet, and seeking medical advice when necessary, you can maintain healthy iron levels and enjoy better overall health. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health tips.